A split screen shows a slide on the right with the title Pathways to Work Evidence Clearinghouse, sharing the Pathways to Work Evidence Clearinghouse with TANF administrators. The logos for OPRE and Mathematica are seen at the top of the slide. The text is overlaid on an image of a woman wearing a hard hat at a construction site. On the left are video thumbnail images of the moderator Sarah Wissel, along with panelists Dana Rotz and Kim Klum, who are introduced later.
Good afternoon, everyone, and welcome to today's webinar. I'm Sarah Wissel, Deputy Project Director for the Pathways to Work Evidence Clearinghouse. Pathways is a project of the Office of Planning, Research, and Evaluation, or OPRE, within ACF. Pathways provides a comprehensive, transparent, and systematic assessment of the effectiveness of interventions designed to help job seekers with low incomes to succeed in the labor market. During today's presentation, you will learn about how Pathways can support your work. We'll start with an overview of Pathways and a demonstration of how you can use Pathways to support your work. We will then hear from two panelists on how they use evidence in their work. And we want to make sure that we save as much time as possible at the end to address any questions that you may have. Please feel free to submit questions through the questions widget at any time during the presentation. We formally launched the Pathways Clearinghouse during an event on July 15th, earlier this summer. Were any of you able to attend that event? You should be able to see a poll on your screen where you can indicate if you were able to attend that event. We'll just take a minute and make sure everyone has a chance to respond. Well, it looks like several of you were able, a good share of you were able to join us for that event. We're very happy to have you back. And for those who are new to the Clearinghouse, welcome. We're so happy that you're here with us today. So, who's here? Today's event is comprised of state and local TANF program administrators. That's important because we really want to focus on how you can apply the Clearinghouse in your everyday work. So during today's event, you can expect to learn about how the Pathways Clearinghouse is how the website works, what we do, including what we include in our reviews, how that information is assessed and summarized, and how you can leverage those resources. The URL for our website is shown in the lower right-hand corner of the slides, so you can feel free to visit the website at any point during our presentation and even follow along during the demonstration portion.
The website is at pathwaystowork.acf.hhs.gov. Before
we proceed, I'd like to introduce Kim Klum, a senior social science analyst at OPRE and the project officer for Pathways.
Oh, thank you so much, Sarah. So we're very excited to have this opportunity to share the newly launched Clearinghouse with an audience of people for whom this was specifically designed to reach, TANF administrators. The Clearinghouse reflects really a great deal of very thorough, careful, and thoughtful work by our office and by our project team, which is led by Mathematica. To create the Clearinghouse, we consulted broadly, learning from experts on the systematic review of evidence, as well as from other key stakeholders, including TANF administrators like you, to ensure that the Clearinghouse reflects the perspectives of potential users. The result is a rigorous review that presents a great deal of sometimes very complex information in ways that we very intentionally tried to design to be transparent and easy to understand. The Clearinghouse builds on an earlier project that my office had completed. The project was called the Employment Strategies for Low-Income Adults Evidence Review, and we were very happy to have a statutory mandate to expand on that work. The Clearinghouse is meant to be a resource for practitioners, policymakers, and other stakeholders. But in order for it to be useful, potential users have to know about it. So we're very pleased to have this opportunity to speak directly to such a core audience. And I want to thank the panelists who will be coming after me for helping us introduce this resource to you. And I really look forward to this conversation. I'm handing it back to Sarah. Thanks so much, Sarah.
Slide title, Participant Learning Objectives.
Thank you. So ultimately, at the end of today's presentation, we want you to feel comfortable and confident using the Pathways Clearinghouse as a resource to inform policy and practice in your organization. By the end of the webinar, you should be able to identify why and how to use evidence and to use the website, be familiar with the content and functionality of the website and be able to navigate the site to find answers to your own questions. So we'll revisit these at the end and make sure that we've accomplished them.
Slide title, Consolidated Appropriations Act of 2017. Detailed text of the Act is read by Sarah.
The Pathways to Work Clearinghouse, as Kim mentioned, began through the Consolidated Appropriations Act of 2017. That act directs HHS to create a database of projects, which we refer to as interventions, that have used a proven or promising approach to move welfare recipients to work. The interventions need to be categorized by their evidence of effectiveness, that is, whether the interventions are supported or whether more research is needed. HHS has to establish criteria for each of these categories, and HHS needs to create a public database of the findings.
Slide title, Goals of the Pathways Clearinghouse. The 4 key goals, conduct, rate, develop, and promote, are shown in boxes with detailed text explained by Sarah.
The Pathways to Work Evidence Clearinghouse is a user-friendly website that has been designed to meet the needs of administrators and can support the use of evidence-based practices. The Pathways Clearinghouse has 4 key goals. First is to conduct a systematic review of the impact evaluation literature on employment and training-focused interventions for individuals who have low incomes. This review needs to be transparent and comprehensive. The next step is to rate those interventions according to pre-specified criteria to determine if the programs have outcomes that are well supported, supported, not supported, have mixed support, or have insufficient evidence or no evidence on which to assess their support. Specifically, we are interested in the impacts of employment interventions on increasing employment and earnings, reducing benefit receipt, and increasing attainment of educational and training credentials. The third goal is to develop a high-quality, user-friendly website that presents the review's findings and provides additional materials to make it easy for users to navigate. In addition to information about interventions, the site also has videos and will have syntheses about different approaches for improving employment outcomes. Last but not least, an active goal of Pathways is to promote the website and ensure that key stakeholders, including all of you, are aware of the website and its usefulness. Obtaining stakeholder input to inform each of these goals is an important and guiding principle in how we have developed this clearinghouse and how we continue to develop this clearinghouse. We want the Pathways Clearinghouse to be informed by the wisdom, insight, and guidance of end users like you. We've held various expert stakeholder meetings to obtain input on the scope of the review and the content and features of our website.
Slide title, Research Targeted by the Review. 3 sections titled Population, Time Period, and Setting are shown left to right with brief text in boxes next to each title.
Pathways targets research that meets the parameters shown here, which are broadly aligned with the TANF program. We target research where the population was participants of age 16 or older with low incomes, which is generally aligned with TANF participants. We also have limited the scope to interventions or to studies released in 1990 or later. As many of you know, 1996 was a key deadline. It was a key milestone for TANF. And so we've included all of the research for a little bit before then as well. And then we our setting so far has been limited to interventions that took place in the United States or Canada. Now, we recognize that there are other clearinghouses that overlap a bit in scope with Pathways. However, Pathways is unique in several really important ways. So the Department of Labor's CLEAR also targets research on employment and training programs, but they include programs for people younger than 16 and do not limit their scope to research on interventions for people with low incomes. The Department of Education's What Works Clearinghouse reports on some interventions with education and training components, but is primarily focused on interventions to improve educational attainment. And some of you may be familiar with the Employment Strategies for Low-Income Adults Evidence Review, or ESER, that Kim mentioned. This website, Pathways, builds on all of the great work and research that ESER did, as well as so we've included all of the research that was in ESER, as well as some additional research that was not available in ESER. And while ESER was focused on individual studies and presented findings for individual studies, Pathways also summarizes that evidence at the intervention level. And we'll get into that in a little bit.
Slide title, Key Definitions. 2 boxes titled Outcomes and Effectiveness Ratings are shown below the title with supporting text explained by Sarah.
So let's review some key definitions that will be important throughout this presentation and while you use the website. First, there are 4 central outcomes of interest for Pathways, and we'll be reporting on those outcomes and summarizing summarizing the evidence on each intervention for those 4 key outcomes. We're interested in employment, earnings, public benefit receipt, and educational attainment. For employment, earnings, and public benefit receipt, we will report separately on outcomes in the short term, the long term, and the very long term. For each intervention, we rate the intervention's effectiveness on each of those groups of outcomes, and the ratings indicate how confident we are that the intervention would produce a similar effect if implemented with a similar population. The top rating, well supported, is similar to evidence-based, which you may have seen from other clearinghouse type websites.
Slide title, Key Definitions Continued. 3 boxes titled Intervention, Study, and Total Reviewed are shown below the title with supporting text explained by Sarah.
Now, an intervention is a specific bundle of services in a given context. You sometimes think of these as programs, and an intervention, so for example, an intervention might provide job search assistance and supportive services to single mothers. A study is an analysis of the effects of an intervention. That hypothetical program for single mothers might have been studied in 2015 in Tennessee and in 2018 in Alaska, and those would be 2 separate studies of a single intervention. On the landing page of the website, in the bottom left-hand corner of the page, you'll see reviewed to date, and it lists some counts. So this provides the count of the number of interventions that are included in the website so far and the number of studies. We are continuing to review content, and those numbers will increase with time. So while each intervention, each of the 161 interventions was a focus of at least 1 study, many of them were a focus of more than 1 study. So the count of studies exceeds the count of interventions for this reason. Now we have another question for you, and we're curious. Which of the following reasons that you may have not used evidence in making a decision at work in the recent past? So we'll give you a couple minutes to think through whether any of those apply to you. All right, well, it seems the most common challenge is not knowing where to start to look. So we're really hoping that Pathways will help solve that problem for you, as well as providing you with a trustworthy source and a source where you can get your information quickly.
Slide title, Example 1, Building a New Program.
Now, let's look at some specific examples of how you might use Pathways in your work. In this first example, you are starting from scratch to build a program and don't have any specific outcomes mandated. You may also be responsible for writing an RFP for relevant organizations and local governments to bid to run this program locally.
Slide title, Example 1 Continued. Select Outcomes. Below the title on the left is an icon of a checklist with text underneath that reads, What outcomes do you want to improve? On the right is an icon of an arrow in a bullseye with text below that reads, What has worked to improve these outcomes?
So on the website, and we'll show you this in a minute, you will use our Find Interventions That Work search to show you interventions that have been evaluated and provide you with information on the outcome domains that demonstrate the effectiveness. In other words, it'll show you what works, what's been shown to work. So when building a new program, a good place to start is considering your end goal. So we start with what outcomes do you want to improve? And then from there, we can explore what has worked to improve those outcomes and assess what of that will work in your context. So now let's go ahead and try this on the website.
The home page of the website is shown. The web page is comprised of a banner at the top with the Pathways to Work logo, and to the right are links to sections titled Find Interventions That Work, Other Pathways Resources, About, and Help. Below the banner is an image of a woman wearing a headband in an industrial setting. A text box to the left gives a general description of the clearinghouse. The moderator clicks on the text Find Interventions That Work, which links to a search page.
So this is the homepage for our Pathways to Work Evidence Clearinghouse. From the homepage, you're going to go to the Find Interventions That Work menu, and then again to Find Interventions That Work. This is the search where you can identify interventions by a number of different criteria.
This page has a banner at the top titled Find Interventions That Work. Below the banner, on the left, is a box with 6 effectiveness ratings. The ratings include well supported, supported, mixed support, not supported, and insufficient support, and no evidence. Below this box are filters for sorting by intervention name or characteristic, filtering for favorable outcomes, and filtering to show similar populations or services. A text box below these allows for filtering by date range. At right, results of the search will show.
So first, we're going to select the outcomes that we want to improve from the filtering menu. So let's decide we want to improve outcomes in earnings and employment. We'll select them and then click Apply. Now, we see that this allowed us to filter for favorable outcomes. What this means is it limits results to interventions with evidence that they improve any of these outcomes. By selecting multiple outcomes, so earnings and employment, we're asking the website to display interventions that improve earnings and/or employment. So from here, we look at the results. This table provides us, the first column is intervention, that's beginning information about interventions rather than individual studies. So this is the name of the intervention. And then we see a set of icons. So these are the ratings that are assigned in each of the domain categories. So this first intervention has a supported rating as evidenced by the green icon with the upwards arrow, a supported rating for increasing earnings. It also has a supported rating for increasing employment, decreasing benefit receipt, and increasing educational and training certification. You also get some information about the populations that are served by those interventions and the employment barriers that those populations may have faced, the services provided as part of those interventions, and we'll look at these other 2 fields in a little bit. Now from here, see that you have 61 results. Myself, I would prefer to narrow this a bit further. That's a lot of results to comb through. And so from here, we're gonna think a bit more about what our, now that we have narrowed our results to what works, we need to look back at our directive. Our task is that the state legislature has just passed a bill to create a subsidized jobs program for TANF program participants. So let's think about how we take that information into account. This is a job for the website's filters. Other than the outcome measures that we've already identified and filtered for, there are filters for 2 other aspects of the interventions, the client characteristics and the services of the program, of the intervention. So we're going to scroll down and use our filters for those as well. So here are these 2 filters.
Sarah scrolls down the page to the filters that read Select characteristics that describe your clients and Select services the intervention should provide.
Let's use what we know from our scenario to further refine our search. Under characteristics, we're going to look for cash assistance recipients. And then we're going to click Apply. That now narrows results from 61 to 24. So this is 24 interventions that serve cash assistance recipients where there's evidence that it improves outcomes in earnings and/or employment. So now let's look at the last filter option, the services, to further refine things. So we want to select we want to filter for programs that offer subsidized employment. We're going to go add that and click apply. Now you'll notice that our results increased from 24 to 36. That's because this is displaying interventions that meet either of the two criteria we just specified. So interventions that serve cash assistance recipients and/or interventions that include subsidized employment. So what you can do is you can actually use this other column to help you out here. So this column indicates the number of selected population characteristics and services matched.
Sarah scrolls to the top of the search results and points to the column on the far right titled Number of Selected Population Characteristics and Services Matched.
So we made 2 selections, and this will tell us how many of those each given intervention result matched to. We can sort our results based on this column either by clicking on the column header or using the sort field. Once we do that, then we will see that the interventions at the top of the list meet all of our criteria. So we see that our top intervention is the Delaware's a Better Chance program. So if we click on the intervention title, we can go see more information about this program.
Clicking on the top search result goes to the page for Delaware's A Better Chance Welfare Reform Program.
So there's a sentence at the top that is a high-level summary, and it tells us that ABC aimed to increase earnings for recipients of aid to families with dependent children through personal responsibility requirements, work provisions, and time limits on benefit receipt. You're probably thinking, your first reaction is probably to note that this is targeted AFDC recipients. That's pretty old, and in fact, we scroll down and we see that this was implemented in 1995. We're probably interested in something far newer, and so we can go back to our search.
Going back to the home page and scrolling down the page to the filtering box on the left that reads, Limit results to interventions implemented on or after, allows for a year to be entered.
And use one more feature in our search criteria, on our search menu, to further refine our results to interventions that were implemented for this purpose of evaluation in a particular date or later, and we're going to enter 2010, so we're only looking at the newest interventions in the database. And we now have 13. So now that we have found interventions that affect the outcomes we want to improve in a setting and with a population that is similar to ours, let's dig into our list of findings. We'll see how to find details on the implementation of those interventions, and we can use that information to help us think about whether or not we would want to consider replicating that intervention and whether it's appropriate for our setting. So by clicking on any one of the interventions in our results, we go back to the page that we saw earlier with more information about the intervention.
Sarah clicks on an intervention in the search results for the Los Angeles County Transitional Subsidized Employment Program.
We confirm that it served TANF recipients, which is what we were hoping for. And then below that, we get a couple paragraphs, sometimes even more information about how that intervention was implemented and what specific services it provided. And so this information here, as well as some of the information on the page, will help us think about whether this would be a good fit in our setting.
Slide title, Example 2, Improve an Existing Program.
All right, so in our second example, you are not starting from scratch. You already have a suite of services that your organization offers, and you're just looking for a way to improve those outcomes. So this might mean that you need to tinker a little bit with what that collection of services is, but you don't want to have to completely overhaul it. You want to tinker. So you can use the website again to do that, but first, we have to describe our current program.
Sarah goes back to the home page and scrolls down the page to the filtering box on the left that reads, Select services the intervention should provide. then clicks on the boxes for job search assistance and job development, job placement.
So if we go back to the Find Interventions That Work page, this is a fresh search with no filters applied. We can scroll down and use the Services menu and select the interventions we currently offer in order to see interventions that are going to be similar to what we have. So if we currently offer job search assistance and job development, we're going to select those two and apply. So there are 97 interventions that offer job search assistance and/or job development. Now we're going to go back to our outcome filter because we're really interested in things that will improve outcomes. So we want to increase earnings and employment, and we want to also look at decreasing benefit receipt.
Under the Select Outcomes You Want to Improve filtering box on the left, Sarah clicks on the boxes for Increase Earnings, Increase Employment, and Decrease Benefit Receipt.
And now we have 48 results. So from here, we can use the Compare feature to look specifically at 2 or 3 of them to look at a head comparison and see which one might be the most appropriate for us.
The column on the far right of the search results is titled Compare and has check boxes to add each intervention for comparison.
So let's look at Atlanta Labor Force Attachment, Broaden Horizons, and we're going to scroll down a little bit and get Fast. So we'll select our 3 and click on Compare.
The intervention comparison page lists each compared intervention in columns with information below. Scrolling down the page shows a table titled Rating and Effect in 2018 dollars and percentages. The table shows the ratings for the short term, long term, and very long term.
Now the table at the top of the page gives you some information about the interventions, including that summary statement that we saw earlier. It tells you about the populations that were served, the services that were provided, and some information about the setting and the time period. If you scroll further, the second table tells you how effective they each were on each of our outcomes of interest. So we see the ratings for the individual outcomes of outcome categories of interest, and we also see the size of the impact. Now we've standardized these so that you can compare across. So even though, as we saw, Atlanta Labor Force Attachment was implemented in a very different time period than the other 2, we've adjusted so that these are all in 2018 dollar values, and you don't have to worry about inflation between them. So looking at this, because Atlanta Labor Force Attachment has a supported rating for increasing short-term earnings, we can be reasonably confident that it provides a favorable effect on short-term earnings, which would be comparable to an increase of a little more than $2,000 per year in earnings. However, we are less confident that Broadened Horizons would have an impact if implemented with a similar population today, even though the research showed that based on that particular setting, it also had an increase of around $2,000 per year. So you really want to look at the rating and the impact together to get the full story, both of the magnitude of the change that intervention might have and the likelihood that it will have that change. And from here, you can also click on the individual intervention names to see more information about any of them.
Slide title Example 3. Assess the evidence for a proposed program.
So we have a couple more examples that we can share with you. So first, you can use Pathways to understand whether a specific intervention or set of services has improved outcomes and for whom. You could use the Find Intervention. To do this, you could use the Find Interventions That Work search to identify interventions with those services, and then look at their ratings and the populations to whom they delivered those services. You could also use the website to drill down to the specific studies if you want to cite any of them in an application for funding to implement that kind of a program.
Slide title Example 4, Specific Populations.
In our final example, you can use Pathways to guide your thinking about how to meet the needs of a specific client group. So let's say your organization has a large number of non-custodial parents and your existing services aren't meeting their needs, or aren't meeting their needs as well as you'd like them to. In this case, you could use the sample characteristics filters to see what interventions Pathways has identified that serves that particular population, and maybe doing so in a way that improves their outcomes. Now, you may not always be able to find an intervention with a well-supported or supported rating that meets a specific set of needs. There's a lot of research out there, but it doesn't cover the full lay of the land. So there are a lot of interventions in the Pathways Clearinghouse that have ratings of little evidence to assess support or no evidence to assess support. What this means is that they've been tried and there was some attempt to understand their impacts. However, the research was either of low study quality or it didn't provide enough information. So we just don't know if those work or not. However, they can still be a great source of really good, useful ideas of what might work, what's been tried, that you could look to in the absence of interventions with supported or well-supported ratings.
Slide title, panel presentation. The text is overlaid on an image of two men wearing hard hats at a work site.
Now I'm going to introduce our two panelists who will talk about how they use evidence in their work. So Natasha Nicolai is the Chief Data Strategist and Deputy Director of the new Research, Automation, and Data Division for the California Department of Social Services. Natasha is responsible for the development, implementation, and evaluation of policies and procedures regarding the department's data, research, and evaluation efforts, federal, state reporting, program integrity functions, and oversight of automation and data verification efforts that support service delivery to eligible Californians. She is also responsible for strengthening her state's capacity to collect, govern, analyze, and utilize data, and to conduct research and reporting activities. She previously served as the branch chief at the California Work Opportunity and Responsibility to Kids, CalWORKS, and Family Resilience Program in 2019. Christina Mesa was appointed to the CalWORKS and Family Resilience Branch, the TANF office at the California Department of Social Services in July of this year. Since 2019, Christina has held various positions in the CalFresh and Nutrition Branch, or SNAP, at the department. And most recently, she was leading the Policy Employment Bureau for CalFresh. And prior to that, she led the efforts of the CalFresh Employment and Training Program. And before joining the department, Christina worked with the Orange County Asian and Pacific Islander Community Alliance, a nonprofit community organization where she led the workforce development programs and oversaw their English learner pilot, many of which were CalWORKS recipients. And even prior to that, Christina worked in Los Angeles with county partners, where she administered several workforce development programs serving vulnerable populations, including immigrants and recipients of our safety net programs. Natasha, would you like to begin?
Great, thanks so much, and hello everyone. Appreciate you having me here. As you can imagine, in this new role that I've just taken on as the Chief Data Strategist for the California Department of Social Services, evidence is kind of the name of the game for me. It's actually one of the through lines to my entire career trajectory. I started out in medicine 15 years ago and transitioned into public policy. And if there's one thing I love across all the various work efforts I've engaged in, it's definitely data and evidence. So I want to first give a shout out to OPRE and thank you for putting together these kinds of literature clearinghouses. I found them incredibly valuable throughout my career in public policy research in particular, and as I stepped into the first role I had as the TANF director at the state, and certainly now as the chief data strategist. So there are a lot of ways that California is interested in using literature and data and evidence moving forward, and specific to the Department of Social Services, where we fight poverty, I think, in a lot of different ways. We're especially interested in how this evidence can guide our practice moving forward as a department. We are attempting wholeheartedly to take a more person-centered approach to our work, which means consolidating and linking data in a lot of new ways and really demonstrating the effectiveness of programming as it exists and where we're trying to go in terms of policy updates. We're trying to take a more whole family focused approach and really create metrics and data infrastructure that work for all of social services as a department to better think through our policy decisions moving forward. So that means a number of different things specific to the TANF environment. As you may know, at CDSS or just in the state of California in general, we have a very robust stakeholder engagement process in terms of developing legislation, policies, and budget in particular. And as part of those life cycles of both the budget and policy making in the state, we have incredibly robust engagement with advocates, with the legislature, with our partner departments. And oftentimes as we go through those budget considerations, and especially right now in times of scarcity, to make arguments, it's really critical that we have access to the evidence for what works, that we can demonstrate the need for that kind of programming and also the effectiveness of that programming as we look at various populations of interest to the advocacy community and as well as our legislators. And so most recently, we were having some debate, some rigorous conversation around whether or not we would continue our expanded subsidized employment program across the state that's delivered by counties in this time of COVID and scarcity. And it was really helpful for us to be able to look back at evidence and point to findings that demonstrate the effectiveness of not only subsidized employment, but for whom and in what types of environments. And so it was incredibly helpful for us to be able to leverage this kind of literature to make those arguments and to have a robust discussion with our partners about how we would fund those programs and what kind of policy decisions we would make moving forward. The second slide, or excuse me, the second bullet on this slide here is something that was already spoken to, but was of interest to me most recently as I was sort of transitioning out of the TANF role, and that was that we have a lot of interest around serving non-custodial parents. And while California is very generous in our TANF program and the way that we deliver and support families, it's not always as focused on those non-custodial parents who might not be receiving the full scope and benefits of our TANF program. And of course, in a time like this, it's of great interest to make sure that the whole family is really focused on to ensure the safety and well-being of the children moving forward. And so it's really nice to be able to look through a set of evidence and make some determinations around a pathway forward when considering this type of policy or new legislative interest, specifically in this case, to non-custodial parents. I could talk all day about evidence and data, but let me hand it over to Christina, who is my replacement in the TANF office. Very excited to have her on the line with me today to speak to some of our more current considerations. Christina?
Thank you so much, Natasha, for that introduction. So very big shoes for me to fill, and really happy to be a part of the team. As was said in the introduction, I just started and joined the CalWorks team, or TANF program, in July. So I'm about a month into the position, but I am definitely not new to TANF, administering welfare to work programs in both LA and Orange County. So really excited to support some of the state programs and services, especially with this new lens, right, of making sure that the decision-making and policy pieces are evidence-informed. So to add to this conversation about utilizing this resource to inform our policy and our practice, we have on the slide in front of you some tangible examples of use case scenarios that we've been able to utilize the tool for specifically here in California. And jumping off of a call just a couple of weeks ago with other states, I know one area that we're all focused on, and I know Natasha kind of gave the big picture in the areas that we're looking into in terms of informing our decision-making with evidence around some of the budget and policy decisions that'll impact our programs and services at the department. But for us in particular, in the world of TANF, I know a lot of us are thinking about how we kind of develop our COVID-19 response efforts and our action plans for our services. And one big component that has continuously been brought up in these conversations has been around not just responding to folks in offering remote and distance learning opportunities for our clients in the welfare to work space, but also this question around capacity as we all are starting to face increased caseloads and an increased need in our services and our local programs. So with that in consideration, one thing that the tool does that's pretty cool, and I was able to utilize the tool just last week to kind of facilitate some internal conversations around this piece, is that it identifies specific interventions that offer these responses to COVID-19, and it'll identify those interventions that offer remote services. So a really key component in informing some of these action plans that we're developing to ensure that the services or interventions that we're referring to have the capacity or capability to offer these services remotely. So just great in terms of informing all of our action plans as we kind of embark on this together, right? And then also, again, right, meeting the needs around capacity as we start to face increased caseloads and increased needs locally. So it's just able to do both, utilizing the tool with that specific functionality. And then we've linked resources too in this slide, just so you can see the results of some of our key use of the tool itself. And then the second piece that I have here is responding to some of the local economic needs during a recession. So while we're developing our COVID-19 response plan, we're also hyper aware of the fact that we're about to respond also to the recovery efforts, right, once we reach the other side of the pandemic. And so we are making sure that we are looking at some of the historical references of what worked during ARA, right, the American Recovery and Reinvestment Act, back in 2008 during the Great Recession, to see which key areas were really critical in identifying local economic needs and helping with local economic recovery efforts. In ARA, right, one of the key pieces that really helped support local economic efforts was around this investment of expanded subsidized employment, right, which was one of the key areas that Natasha had referenced as a need for us in California, because as businesses are able to open up, one area that they turn to is that support of being able to have that subsidized employment opportunity for them to be able to support some of their work and reopening efforts locally. So those are key areas that we're considering and able to utilize the tool as it has the ability to be able to search evidence based on year. And so in our initial searches, we were able to look at some interventions that took place around the time of ARA and to see which funding and supports were utilized to bring some of that work forward. And then the last piece that we utilize as an example here on the slide is maximizing opportunities for co-enrollment in a time of very limited resources. So I know this has been a large part of our conversations with other states as well, right? So when we did a search and we looked at outcomes, and we wanted to ensure that we were providing services that incorporated things like mental health and healthcare services, because there are, in some of those funding opportunities, there is some funding that's allocated specifically for workforce development. And so typically you don't see a whole lot of opportunities for co-enrollment, even though that they are intended to exist, and they're inherent in part of that funding structure, because the idea is if we have this whole-centered, a whole family, whole person approach to service delivery, then there has been some developments in some of the mental health funding, and particularly with IPS, or the individual placement support funds, which have a lot of flexibility and opportunities for co-enrollment with us in TANF. So looking at those specific models and being able to search through those interventions and see the effectiveness of that evidence, and to see that it actually worked for some programs and services locally was critical, right, to informing some of the conversations we're having around how folks can identify those local opportunities for co-enrollment in their programs and services in our counties. And so I wanted to flag here, there's one intervention in particular as part of this initial search and utilizing the tool that spoke specifically to that mental health services component in healthcare services as integrated into their co-enrollment process. So really excited to kind of dive into the tool further and identify other key conversation and areas around how we can utilize it to inform some of these policy decisions as we move forward in a time that where things are very much unknown. So we found it to be really useful in our internal conversations, and then again, right, and informing some of the conversations we're having with some of our other state partners. So with that, I'll turn it back to the team for some of the other pieces.
Thank you. Before we proceed, I was wondering if you could, either of you could speak to how you are able to bring evidence to conversations with other stakeholders, and whether to the extent to which that's a challenge, or if there's a particular way to pitch it so that there's buy-in for the use of evidence to inform decision making.
Sure, I'm happy to take a start there, Christina, and then have you follow on if that makes sense. We have found that the production of data, and in particular the evidence of existing programs, is really critical. Like I said, we have a very interested and robust engagement with lots of different stakeholders, a research community, advocates, and our legislature is very well informed when it comes to data and local control and how funding opportunities are allocated, et cetera. So we're always kind of under the gun in terms of providing data. So one of the things that we had developed for the TANF program here in California is called CalOR. And as part of that effort, we really worked with the existing evidence, and I think additional evidence from this will be helpful for us to think through what are those performance indicators that are of general interest to all of those various stakeholders, and how can we feed data into a robust structure that reflects the effectiveness of those programs and the performance by county, by population, by program type. And so we've created multiple dashboards. You can actually find them online. CDSS CalOR will take you, if you Google CDSS CalOR, it'll take you right to one of our key dashboards, which has employment indicators, it has income outcome indicators, it has sort of service length, duration, access, ethnicity, race. We're very interested in equity here. And so generally speaking, what we have found is actually bringing evidence to bear through data has given us quite a bit of leverage in terms of making that robust argument for what works and what doesn't. We generally do rely heavily on evidence and on studies. Like I said, we have a very well-informed stakeholder community who are educated in terms of what it means to have robust evidence. Now that we have this new division, which I'm heading up, research, automation, and data, we continue to have engagement with stakeholders. We're very good and well-versed at sort of translating evidence and academic literature into consumable information. And generally speaking, once you get down to the numbers and you can depict that through a data narrative, the conversation gets much easier. So that's what we've been doing here in the state to make sure that everyone understands sort of where we're trying to get to and the evidence we have to get there. But would love to hear from Christina as well, in particular on that local aspect, which is so critical in the state of California.
Yeah, and I think that one area that we've been able to do really well is, working towards, right, is making sure that the folks on the workforce development side of the house, which, their programs and services and the funding that they have available to serve folks in our local communities are just as critical to our TANF program as our TANF funding, right? So ensuring that they're all informed of our process and being able to have those coordinated conversations with our state partners, and ensuring that that information is consistent, right, with their delivery to local workforce boards and in alignment with the communications that we're administering to our county welfare departments, who, in California, we're a very large state. Our workforce development system has a lot of multiple touch points because we are such a large state. And how workforce looks, right, in local areas is quite diverse. It has many different complex ecosystems, just depending on which county you reside in or local area, right? So they're just making sure that messaging is consistent across both lines of communication has been critical. But I think we've done a lot at the state level to ensure that it's happening. And that the resources that we're sharing, such as this particular tool, are shared amongst our partners and providers, because as you can see, these use case scenarios, right, that we are sharing are not just critical considerations for administrators, but also critical considerations for providers. So ensuring that that folks on the ground and in the field can make those connections and understand why evidence is critical, I think is part of the conversations that we're having with some of these stakeholder engagement conversations, or with the work that we're doing in collaboration with our partners over at the California Workforce Development Board, as well as our EDD department.
Great, thank you both so much.
Slide title, Summary. Subtitle, Strengths. Key points outlined.
All right, so to summarize what we've all been learning in the past 50 minutes, the Pathways provides you with a free website resource that is quick and easy to navigate, particularly the Find Interventions That Work search. It also provides you with a comprehensive assessment of the research on employment and training programs for adults with low incomes, with 216 studies in the database so far. Again, that number is going to increase in time. provides you with relevant information about employment-focused outcomes for job seekers with low incomes across those programs, and a transparent and high-quality process that was used to assign ratings to studies and to interventions to help you make evidence-informed decisions. So for these reasons, we really hope that you use this resource and find it useful in making your evidence-informed decisions. And we hope that this presentation has helped you to identify why and how the Pathways to Work Evidence Clearinghouse is relevant and useful to you and your organization in your everyday work, has enabled you to navigate the site to practically answer the questions that you do face and learn about a topic, and has given you information about the content and functionalities of the website so that you will be comfortable while navigating that website.
Slide title, Participant Q&A. The text is overlaid on an image of a woman wearing a hard hat at a work site.
And with that, I'd like to thank you all for attending today's webinar, and we're now going to open the floor for questions that you may have asked, and I will introduce Dana Rotz, our principal investigator, to moderate that Q&A session.
Hi, everyone. Thanks again for attending today. I'd like to invite folks to please share any questions that you have through the question and answer widget that is part of the On24 platform. We are looking forward to your questions and to opening the discussion up a bit more broadly. So the first question, I believe, is for Sarah, and that's, can you describe what the supported rating means and what quality of study is needed to make that determination?
Yes, so the supported rating is the second highest of our ratings, right below well supported. It means that we are reasonably confident, but not completely confident, that the findings that we have reported from the existing research on that intervention would be what you would experience if you were to implement that intervention again with a similar population in a similar kind of context. These interventions require, to receive the supported rating, it means that there is at least one study of moderate or high quality that shows evidence of favorable findings amongst the given collection of outcomes, and that there's no evidence that the intervention leads to unfavorable findings within that same collection of outcomes. So for studies of moderate or high quality means that they're reasonably rigorous, and we can trust the findings to be the correct statement of what the effect of the intervention was at that point in time.
Thank you, Sarah. I think there's another related question for you, which is, does the Pathways Clearinghouse provide a list of promising strategies to consider other than the supported?
So we have the list of, you can get a list of the interventions with a supported rating by using the Find Interventions That Work and that filter I showed you to filter on outcomes that have been shown to improve a given, or filter on interventions that have been shown to improve a given collection of outcomes. If you want to look at something that's a little higher level than intervention, so an overall approach or strategy, that's something that we don't have at this point in time, but we are looking into how we could summarize that, and I would encourage you to come back and visit the website in the future.
Thank you. I'm going to give folks a little bit more time to submit their questions. Here's another one that just came in. Does the Pathways Clearinghouse include interventions evaluated with methodologies that are only experimental or also quasi-experimental designs? Sarah, you might still be on mute.
Thank you, Dana. Sorry. So the Pathways Clearinghouse includes research evidence based on both experimental and non-experimental methods. So we include research that used a randomized control trial design and research that used a quasi-experimental design. For those of you who don't have a chance to ask a question now, either because it doesn't come to your mind until later, or just weren't quite sure about how to express it, or whatever the case may be, you are always welcome to submit your question through our help desk at a later point in time, and we will get you a response. So you can access that on the Connect page on our website.
I have one more question that's coming in for you, Sarah, and that's how are interventions selected to be included in the clearinghouse? Have you included apprenticeship and youth apprenticeship programs as part of the review?
Okay, so yes, we have included apprenticeship programs. We identify the interventions based on the research that we identify. So we don't set out to look at the research on a specific set of interventions. Instead, what we do is a comprehensive literature search for published research that evaluates employment and training interventions for adults with low incomes that was published since 1990 and conducted in the US or Canada, and reports on outcomes of interest to the clearinghouse. So any study that meets those criteria and uses a experimental or quasi-experimental design is added to our pool. We haven't reviewed all of them yet. As I mentioned, there's still more studies to come, but for those studies that we have reviewed, the interventions that were featured within that are now noted on our website.
Wonderful, thank you. Here's one more, and that's, do you have information about interventions that are implemented remotely? These could be particularly important to consider currently.
Yeah, so Christina mentioned these briefly, but so the Pathways website has a specific page that you can access off of our homepage, where we list the interventions that report having delivered some services remotely. So what that tells you is that these are the interventions that, since the onset of the pandemic, have modified their services in a way that allows them to continue to provide at least some services to clients. So that list is available. The only caution I will add is that the effectiveness ratings that we've applied are based on the published research evidence. So in other words, they're based on the way the intervention was implemented in January of 2020 or earlier. And so the modified form that is available now may or may not yield quite the same results, but it's still a great place to go to get some ideas about how interventions are adapting and what you might want to try in your own setting.
All right. Thank you, Sarah. Here's another one that came in from the audience. Do you have a link to all of these recordings on your website so that those who did not see the July 15th presentation, the launch event that is, could see it?
Yes. So we were working on getting the launch event added to our website. So you will be able to access that. And as we conduct other events, we will also work on getting those recordings posted and available on our website as well. So the launch event isn't there right now, but please check back in a little bit and it should be available. You can also watch we will be issuing newsletters and an email blast for people who join our mailing lists. So that's another way to stay in touch and understand and know first right away when we've posted something new that might be of interest to you.
Great, thank you. I think most of these questions have really been for the Pathways Clearinghouse staff, which are great. We're more than happy to answer them. But I did just want to open it up to any questions to the panelists about their thoughts on this and how they use evidence in the Pathways Clearinghouse.
Yeah, so I can start. This is Christina again with CDSS. So one key area that I think is critical, and I know we talked about this briefly, is around making sure that it's accessible and available for our providers. So curious to hear his thoughts from any folks in the audience in terms of thinking around or questions around how to kind of inform our providers as administrators of best practices around COVID-19 and thinking through some of these other service delivery questions that we kind of brought up as part of our conversation, right? And utilizing the tool for those purposes. So curious to hear that if folks have questions particularly around that area, since that's something that we're thinking through. But we also just quickly wanted to share, we have a resource guide that we share out to our county welfare departments at the California State Board, as well as our partners over at EBD share out as well. And so that's a great place for something like this tool to live, right, as a resource. But in addition to that, we also have other resources that we've kind of developed as key things to consider as they're developing their local action plans around COVID-19 and economic recovery efforts. So just wanted to add those pieces quickly.
Thank you for adding that. I did have one more question come in for Sarah, and that is any part of the clearinghouse focused towards work for people with disabilities or vocational rehab?
Yes, so that is a good question. That would be another, what we think of as a specific client characteristic or barrier that people may be facing. So we do have, if you use our Find Interventions That Work search and then use the client characteristics filter, you can filter for interventions that are included in the database that serve people with disabilities.
Okay, I think I just have one more question then for Sarah. And that's, is this clearinghouse better suited for HHS staff, or can clients and other stakeholders access this resource as well?
So the website is free and available to anybody with internet access. It is really designed to best meet the needs of TANF administrators, but that doesn't mean that that's the only audience that will find it useful. So we hope you will share it with others in your network.
Slide title, Next Steps. Follow @Mathematica Now or @OPRE_ACF on social media for the latest updates. Use #Pathways, 2, work. Join the Pathways to Work email list. Visit the site at pathwaystowork.acf.hhs.gov.
All right. And on that note, I would like to thank you all for attending today's webinar. It's really been a pleasure, and we've enjoyed the chance to share the Pathways Clearinghouse with you. We hope you will stay in touch. This slide gives you a few ways that you can do that, and let us know how you like it. Have a lovely afternoon.